Welcome, Helen. Thank you so much for joining us for the ProTech Community Partner Showcase. I know that you're the CEO of Carefirst Family Services Association. And can you tell us a little bit more about the great work that Carefirst been doing?
Okay, so thank you so much, Dolly, for the opportunity to speak to you. So Carefirst basically, since the announcement of the pandemic, so Carefirst has been taking a pretty proactive, role because basically we are a community-based service provider supporting seniors as well as especially say like the population, East Asian, South Asians. And so we've been providing a full range of community support services. So since the announcement of the pandemic, Carefirst has been working very closely with other service partners in ramping up what we call a COVID-19 community response services. So that was even before the availability of some of the federal fundings. So several agencies work together, so provide services like hotline services to deliver meals, grocery shopping, providing transportation, such kind of services.
So we heard a lot about the challenges facing like hospital workers or nursing home workers, right? But as community frontline service providers, where were some of the major challenges uh, your staff and volunteers face at the beginning of the pandemic?
Sure. So say like just like as humans, so everybody, have all the same kind of fear, worries, phobia about say the pandemic because we do not really know, really much about it. So for Carefirst especially, we provide say like for instance, counting a lot on our frontline staff to provide services such as homemaking service, personal support services to provide home care services to the seniors in the homes. So because of the announcement of the pandemic and the lockdown of the closing down of many of the essential services like childcare services. So many of our staff, they are frontline staff, personal support workers. So they have to, when they have small children at home, they have to stay home to look after their children. So as a result, number one, there is a big loss of, frontline staff. Immediately, say like we lost 30% of our PSWs. So with the, reduced manpower, how are we going to strike the balance to deliver home care services? While at the same time, many of the hospitals are discharging their patients. So the patients are discharged on home care. So on one hand, we are getting increasing referrals for home care while at the same time we have reduced workforce. So the coping of the say like how we're going to cope with the service volume. On the other hand is that also some of our staff, because we've served mainly like the East Asian and South Asians, and there are a lot of myths, misunderstanding, and discrimination about Asians. So we do have say the incidents that some of our staff experience and encounter that they are the very negative kind of experience that they are being somehow something really unpleasant happened to them. And if I can share with you one example is one of our dietitian. She lived downtown, and when one day, say actually it was last year, say like in April. So when she traveled from downtown to come to work in Scarborough at the medical center, when she put on a mask. And those, if we recall, even say like those days, wearing masks, where they are talking, even say like our say like a public health agency announcing, oh, you don't really need to wear masks. And the mask is only for those who are, you really have illness yourself that you wear mask. So she put on the mask when she was traveling in the subway. So say like someone from the mainstream came up to her and spat on her. So that was a really say like for her as is a very kind of
Mhm.
horrific experience. So what I'm trying to say is that yeah, we have to cope with the increasing service volume. Don't think that, oh, everybody can work at home. No, if you are working the front line, healthcare services, like in the community. You cannot stay and work at home. We do not have the privilege. That is not privilege. We cannot work at home, what I'm trying to say. So you still have to come out to work and meet and see your clients, because they really need, sometimes the virtual care does not serve that purpose, so they have to be in person. So somehow they have to come to work, also have to somehow face the challenge. What if, say, like people, I mean, they discriminate us,
Mm-hmm.
and also they also worried about catching the virus themselves. So it's a lot of pressure on the frontline healthcare staff, whether they are PSW, whether you are a nurse. So we definitely share the stress. I mean, our healthcare professionals working in the acute care, but the same thing, working in the community, providing community care is the same kind of stress that we are experiencing. So talking about coping with the work pressure, how do we meet, clients, demand for services, but at the same time, people, the staff themselves also worried about coming to work. And if we do not have, again, like the issue of PPE supplies. So often that the priority when we go to our vendors to order, supplies, they just put us in the back order because they said the priority will be given to the hospital first. So for community care, you are in the back order. So one of the thing is that, so it's all these concerns, worries. It just everything happen at the same time. So it's a lot of things to cope with.
Yeah, so I think what I'm hearing is that really, we a lot of times we didn't realize the importance and the value of community care, and and also our staff are also human, and we have family lives, we have community lives, and we are just as impacted by the
Exactly.
pandemic, right? And some of us do not have the option of working from home. So, and for you, I guess care first, because like home care is your mainstay of services, you really do not have that option, right? So it
Mm-hmm.
actually places a lot more demands on
Mm-hmm.
your services. So I
Exactly.
really appreciate it. But also, like, I'm wondering, like, we can probably learn from your experience of how you adapt your programs and how do you support your staff through all these challenges.
Mm-hmm. So basically, we are really blessed that Carefirst, we do have a team of very committed staff. So really, say like, because I believe, say like across, the healthcare sector, many of the professionals, the employees in the sector, I think one of their major mission is to really to serve and do the best of their abilities. So one of the thing is how we motivate the staff is that number one is to protect them. And so we are fortunate in the sense is that because we often for Carefirst have because serving Chinese, and say like, even we keep it very closely, say like what happened in mainland China when the incidents occur. So immediately we stock up our PPE, and so basically number one is the message to our staff is that we will, do the best of our abilities to, protect them. We understand if they face challenge is that well, if they really cannot come to work, so the HR policies that let them, you take your time off if you really cannot do so. So one of the thing is really to support the staff, and then to understand, say that also the kind of psychological, the mental well-being of, to support each other. And then the other the other part of your question is that how do we also do things about the community?
How do you adapt your services provision, like any other
Yeah.
strategy?
So adapt the provision is that earlier I talked about immediately we understand what are their immediate needs. So for instance, especially we understand we serve seniors, and in the first wave they talk about, oh, seniors would be the really hardest hit by the COVID-19 because of their age, their health conditions, chronic disease, etc., etc. So immediately we quickly adapt and change, say like work with the other agencies to provide that COVID community response services. And then the other thing is to change our approach into the hybrid model. So providing services like a hybrid, when we talk about, is is there the opportunity to provide services virtually? So fortunately, we do have an in-house IT support team. So quickly we can move some of our services into a hybrid approach, like adapting the virtual platform, using definitely using telephones, counseling, and also using say like the virtual platform like YouTube to provide a lot of health education program through YouTube. And some of the, we also say like understand one of the biggest challenge of our seniors that they do not have the connectivity or the technological, the kind of techie, I mean, knowledge, skills to be hooked up to an internet, or they don't even have a computer or say like the connectivity. So one of those preliminary, I mean, going back to those old approaches, that telephone, using the telephone, I mean, to have the social program, so at least the chit chat together, to dial in the teleconference. So really have to be really creative to adopt different strategies to engage our seniors so that they won't be able to, I mean, that because isolation, social isolation is one of the really kind of detrimental factor to our seniors that put them in depression and fear, because we often encounter seniors that they were, especially for those who live alone, worrying that say like, what if one day I passed and no one noticed. So somehow we quickly change into a lot of those strategy, and at the same time deploying our staff to deliver what we call the emergency services, like a hotline, manning a hotline to provide, coordinate a lot of those emergency support services, like deliver meals, grocery shopping for the seniors, and also support the hotline, counseling over the line, etc.
Yeah, so that takes a lot of proactivity, community care, and commitment. So thank you so much for the great work that you're doing. And so I know that you're uh, right now you're providing a lot of services still. Would you like to share some of that with us?
Yep. So one of the thing is that actually the Ontario Health, they have somehow the end of 2020, last December. So sometime around Christmas time, they identify, say like in Ontario and especially in the GTA areas, identify 15 hot zone areas. So maybe can we go to slide number 1? So they identify, say, across the GTA surrounding areas, hot zone areas, and we are being tasked by the Ontario Health to take leadership to work with local service providers to support. One of the hot zone areas is the South Markham, because looking at the South Markham, they have the what they call the FSA areas that they identify, that neighborhoods are really multi-ethnic, immigrant neighborhoods. The people are marginalized. So for instance, the kind of housing condition, they live in generational housing condition, talking about the kind of income and dependency. So, and also one other very important factor is that the very high positivity rate when they go for the swab test, but they have very low testing rate. So as a result, they have a high incidence of members, committee members tested positive. So the government asks us to provide 3 pillar services. So number 1, they ask Carefirst, can you work with the local agencies to provide, say, like increase the accessibility to COVID testing, to do some sort of like a community health education, to outreach to the community members, to educate them about swab tests, to educate them about vaccination. And thirdly is to provide the wraparound care for those who are tested positive. So which we did. So fortunately, we've been able to work with a whole, say like say like many service organizations who are so ready and to come out and support. So this is the list of agencies that we partner with to serve South Markham. So they include like the York Region Public Health, the local hospital, Markham Stouffville Hospital, 2 settlement agencies, the YMCA, etc., etc. Next slide. So as a result, towards the end, we're able, quickly in January, ramped up additional 5 swab mobile test clinics. So for instance, like we said, one swab test clinic at YMCA, one at the church, one at the Muslim temple, and also at Carefirst, our medical center, and also one is with a community center. So as a result, we are able to increase the number of swab tests every day, say that from Monday to Saturday, and we on an average basis, we do have say like at least like 50 swab tests being done, and the tested the positive rate is between 5 to 10%. Next slide. So about the community outreach, so we have adopted a whole slew of different approaches, including having community ambassadors go and talk to the people, distribution of health education materials, PPE kits, and have also provide a whole series of virtual health education, town hall meetings through mass media to really using different approach to educate people about the importance of protecting themselves from the virus, to have the swab test if necessary, and also to come out for the COVID vaccination. Next slide. So this is one of the example that is a health education session that we specifically provide for those who have diabetes conditions, so that they know that how to protect themselves. Another slide. So this is give you some sort of idea about how do we provide wraparound care. So basically for those who are identified tested positive, so we'll take the initiative to approach them, attach with them a caseworker, a case manager. And this is on the bottom of the slide shows you the kind of services, the variety of services that we provide for them, which includes like transportation, childcare services, counseling services, and other tangible services like food security programs. And then so far, up till now, we've been able, say that since January, so we've been able to serve 180 families about this wraparound care. So moving forward, the next slide. I think that's most important is that light is through the tunnel. And right now, what we are working at is to help people to educate them about the importance of vaccination. And we do have a hotline, help those without the language skills or without the internet connectivity to help them book appointments. If they can do so themselves, so here is the different online bookings that they can go and do it for themselves. But if not, then they can call our hotline, and then we can be able to provide them the support. And also not just to help them book the appointment, but also if they need transportation, we'll be able to support them as well. So maybe I'll stop here.
So that's a lot of work, and I think important services. What do you see as we are now in the third wave, the main challenges facing our communities are, and what would you suggest that we focus our energy on going forward?
So again, I think all of us are fatigued about, say, like coping with COVID-19, but we cannot give up. And most important of all, I think it's really be positive, and us as a community member support each other, whether you have family members, support them, neighbors, reach out to your friends, call them up and support them, encourage each other, because light is through the tunnel, and we have to somehow be able to really accept, say that if you somehow may have some myths, misunderstanding, or iffy about vaccination, so somehow go and speak with your healthcare professionals, seek their advice, and think about receiving vaccination is not just to protect ourselves, but basically do good for others, is protect others as well. So I think we have to keep our spirit up, and not just say for those providers, service providers, but I think all of us be confident. And yes, there are down days. Say everybody, I mean, goes ups and down, which is normal. But I think most important is to have this kind of the kind of campaign that Dr. Lee, you are leading, is to really somehow be able to support each other, encourage each other, get more information, be educated, so that we be able to move forward and have hope. Hope that's, yeah, definitely light is through the tunnel.
So what are some of the key hesitancy you see in the Chinese Canadian community about vaccines, and like what are some of the barriers, and how can we work together to deal with some of those?
One of the thing I find, and honestly speaking, is the among Chinese, maybe it's our national character that we are pretty compliant, honestly speaking. Say like there are research statistics show, say like about hesitancy. They have done, I think it's ICES or Kai Hai, they have done the research, say like talking about, yes, the hesitancy is more about, say like maybe because of historic experience, that the Black community has a really high kind of hesitancy, like something like 46%.
Mhm.
And then moving downwards, the South Asian is around about 30%, and East Asian is 28%.
Mhm.
So basically, and the mainstream is 25%. So if we say like, no, that is roughly 30% of us are not that confident about the vaccination. So one of the thing is that maybe people say like, oh, I don't really know, say like whether it works or not, and is it a poison and injected in my body? So trust the science. Trust the science, and there are say like they did their due diligence, and so speak to someone who are knowledgeable to have our myths, misunderstanding clarified. And one of the good thing I see, say like within Chinese, the compliance, say because of our national um, character. So Chinese is being more like and also the kind of collective kind of mindset with that we do things not just focusing on our individual well-being, is, I mean, for others good as well. So I think we can reinforce this spirit. And then the other thing I see, the more the barriers, is not that they do not want to come out to have the vaccination, is how we'll be able to make the vaccinations more easily accessible. Like they may have barriers, like so for instance, I work in the say I have to go out to work, say like I have parents at home, nobody's take them to the vaccination clinic. So if we be able to provide them a bit more instrumental support, like provide them the transportation, or they do not have the language skills to book the appointment, just to help them to overcome, I mean, those I mean pretty tangible kind of barriers, so it is easier to do, easier to overcome. More is the resistance is more that, well, is the mentalities that I have myself autonomy. You cannot tell me to do things. Um, so just like many other, I mean, I cannot really comment. I mean, really other, say like people from different cultural backgrounds, is that I don't want to really, you tell me to do so. No, you tell me, say that in a Chinese saying that you tell me go east, I no, I deliberately go west. So but say like we are reasonable people, and so that's really one of the good thing about
Mhm.
uh, the uh, the national kind of character personality about the Chinese. So and of course, if we, I mean, somehow all of us, if really have hope, and also to really support each other, help each other, then there will be like the harmony among us, and well, and then we'll move forward.
Mhm. Yeah, so I think like if we really provide people with good information, good scientific, factual information, and support people getting language specific and access to good time for vaccination and stuff, I think we can together make a big difference, and
Exactly.
hopefully travel through that tunnel and see the light together. So
Exactly.
thank you so much, Helen, for spending time with us. And congratulations to all your great work, and we hope that we can continue to work together.
Thank you so much, Dolly.
Thank you.
Thank you.